Welcome, everyone, to our first City Spotlight. And today we're very happy to have with us the CEO of Monmouth Medical Center, Mr. Eric Carney.
Thank you, Mayor, for having me today.
Let me start. We're just hearing all over about the amazing staff, doctors, nurses, everyone involved at all the hospitals throughout the nation, but especially here at Monmouth Medical as well. So how's it going? What's the morale like here at the hospital?
So, John, thank you for starting with the staff. You characterized them perfectly by saying that they are amazing, and they are just that. I just wanted to really quickly share that throughout the hospital, each of our employees are wearing a mask and under a universal masking protocol. I'm currently holding my mask. I'm conducting this interview in my private office, and so I want to ensure everybody who's watching that anybody who is at Monmouth Medical Center is wearing a mask under our source control protocols, and we are keeping your safety as a highest priority. So our staff, Mayor, I can't tell you enough how much of it's been an honor to watch them do the work that they've been doing over the last 8 weeks. I mean, Monmouth Medical Center is historically an amazing organization who does great work just caring for our patients, and we have tons of awards and accolades that demonstrate that. But what we've seen over the last 8 weeks is really our staff acting in very heroic ways. I mean, they are, as you can admit, anybody in healthcare is very concerned about their own safety, the safety of their families and their loved ones. But each day, our staff comes to work and they do everything possible to care for our patients in the most compassionate way. And I've seen amazing acts of kindness and compassion. Just a few that I'd love to share with you is we have a patient care associate up on one of our medical surgical units named Lisa, and so Lisa had worked previously in her career as a counselor at the camps, and so what our staff saw right out of the gate is with these COVID patients who need to be put in isolation, and our staff needed to be masked and wearing gowns and with eye coverings. It took away our ability to connect on a very personal level with our patients. So Lisa kind of used her skills and her artistic ability and creativity, and she started talking to the staff about what kind of artwork they like and what their favorite images are. And she started drawing with markers on the windows of our rooms, whatever images the patients wanted to see. It just adds an amazing amount of color and life into these units that are very sterile and isolated, and just in a great example of the stuff that the team here at Monmouth has been doing. This past week, we celebrated a patient on one of our med surgery, a COVID patient. We helped them celebrate their birthday. Our staff came together, were able to get a cupcake, and all sang happy birthday to one of our patients who is unfortunately unable to celebrate with their families and loved ones. So those are the things that we're seeing. The teamwork's been amazing. The staff's been supporting each other. They've been taking on new roles as different types of patients have come to the hospital. We've had to do things differently, and our staff has taken on those challenges and supported each other. And in every definition, Mayor, I can share that they are absolute true heroes. And I'm just in awe of what they're doing, and I'm just blessed to be considered one of their colleagues.
You know, Eric, I don't know if you have anything to add to this, but I've said to a lot of people, one of the positives, the real positives in this very difficult time that I've seen is just the compassion, the concern, and the care that I've seen people show to others, to their neighbors, to their families, to their friends. And I don't know, you must witness that every single day. And I was just curious, is there anything else that you can add to that? Because it's truly amazing.
That's great, Mayor, and I agree. And we've not only the internal, compassion and outreach, we've seen it from our community in just a really overwhelming way. So unfortunately, there's just too much to mention because we want to recognize each and every one who has supported us. We've had thousands of meals sent to the hospital to support our staff. We've had our community donate protective equipment, masks, and eye protection and gloves. We've had countless letters and pieces of artwork sent to the hospital that are hanging around each of our entrances. So just as a rallying call for our staff, and they see it every day. And I have to thank you, Mayor, for your support of our Clap In and Clap Out event that we held a couple weeks ago to celebrate the healthcare workers. Chief Roebuck and Chief Griffith were very supportive with fire trucks and police vehicles, and it just added to such a special night. And I know that there were a number of individuals in Long Branch and that under the meals for our staff that evening, and it's still being talked about here as just such a special event. So the town's unwavering support of us has been fantastic, and it's really helped us through this.
Well, thank you, Eric, but I know I speak on behalf of everybody to just say, once again, thank you for all that you do. Let me get to a couple of specifics, if I may. So have we flattened the curve here in Long Branch and, the surrounding area that you serve with this virus, do you feel?
So what I can share is we're seeing a decline, and that's a good sign. We've been watching what's happening in our county very closely. Over the past week, there's been the increase in new cases is actually at 16%, which is a significant decline from the previous week, and where at late last month we were nearly over 100% increase every week. So that is slowing down significantly. I can share that what we're seeing here at the hospital is the number of new patients coming to our emergency room is also declining. And this past week, it's been about a 20% increase. So there still is active cases in our community. We still have to be very mindful of that and continue all the work that we're doing to keep social distance and universal masking and all the things we're doing. But we are seeing good signs of things starting to slow down. The Commissioner of Health has reported that she believes that in the northern part of the state, that they're in a more significant decline than the central part of the state where we currently reside. And then in the southern area of the state, we're thinking that there's still more of a peak to see. But we're in a very good place. The county's in a good place. And locally at Long Branch, we're seeing positive indicators.
So you had indicated that you're very encouraged by what you're seeing. Anything more to elaborate on that or that feeling as we move forward with getting over this?
Just from this perspective of what we're seeing in the hospital. So we are seeing throughout the county and again throughout the state decline in acute hospitalization. So patients coming into the hospital and needing to stay in the hospital. So that's a very encouraging sign. And we're seeing that here at the hospital at Monmouth Medical Center. What is something what we're very mindful of and watching is that the number of critical care patients is quite high at this point. So again, we're optimistic, but it's very guarded by what we're seeing each day here at the hospital.
At the national level, everyone was talking about ventilators, less so now, but do you have enough supply of ventilators and the critical equipment that you need?
We do. We've been utilizing more ventilators than we normally do during normal times. We have not been at a place where we've come close to running out of ventilators. We've also, we were part of a very large health system, RWJ Barnum's Health, and that is an amazing asset for us to be able to secure additional ventilators and this critical equipment, and we can share amongst each site. So we've been sharing quite often between our southern region hospitals, which are located in Monmouth and Ocean County. So that's been a huge asset, but we have not had an issue with ventilators here in Monmouth, and I don't anticipate that we will based on the resources we do have.
In our last conversation, we were talking about non-COVID related emergencies and people going to the emergency and so forth. The emergency room, I'm sorry. Can you talk a little bit about that?
Sure. We still see a significant number of patients from our communities today. We've delivered in the last 8 weeks, we've delivered close to 1,000 babies. We've done hundreds of surgeries. We've seen tens of thousands of outpatient visits. So the hospital is conducting normal operations. I know there's a lot of conversation about going back to normal, but we are trying to make sure we can provide medically necessary care to the community. And I think that's an important distinction, the idea of medically necessary versus elective. A lot of conversation about that at the state level. But the hospital is seeing a good number of our patients. We continue to provide the same level of outstanding care, and we will likely have to balance the world of COVID and traditional care for quite some time. And we are, as a health system, and certainly here at Monmouth, we are concerned with this idea that maybe members of our community are delaying routine care. What we do know is that the incidence of cancer are not going to stop because of COVID. We know the incidence of heart disease is not going to stop because of COVID. So we're constantly working on how we can balance the safety of our community and our staff with being able to provide those critical healthcare services. But it is, rest assured, Mayor, it is happening every day now, and will continue to happen and we will slowly, for the services that have been either reduced or closed, they will be coming up in the near future so we can even better support our community.
People are concerned if there's a non-related COVID issue of going to the emergency room, but you would stress that, never deny going to the emergency room if there's something that's critical.
Yeah, no, I think that's a really important point, and which is a really good sign. We're starting to see more activity in our emergency room department. So we served over 100 patients a day when we were fully operational pre-COVID, and we saw those numbers dramatically decrease. And we were concerned with where those patients are, those individuals who were getting care. Because again, we know the issues don't just stop. So we're seeing them return. It is important for the community to understand if they're experiencing a medical condition that they believe they need to be seen in the emergency room, they should not delay care. We have a tent set out in front of our emergency room, which is helping us assist screening patients and visitors more effectively, and then we're making sure we understand the potential risk for everybody before someone comes into our facilities. But it is, we have our patients in our emergency room that are believed to be suspicious for COVID, or patients who are admitted for COVID reasons, are all being cohorted on individual units, separate and apart from other areas of the hospital. So we're doing everything we can to mitigate spread of the disease and to make sure that everybody who comes to Monmouth is safe.
My office and the health department in particular get a lot of calls about where to go for testing. Can you comment on that, Eric?
So testing remains a very hot topic in the news as well as within the healthcare systems. And so we're providing testing for individuals who are symptomatic and for COVID, which is historically meant cough, fever, congestion. Those are the things that we've been screening for. And if we see someone who has those symptoms and it's a high suspicion for COVID, we're testing in our emergency room. So we do want to, the state and Monmouth Medical Center do believe it's very important that we limit our testing abilities to people who are symptomatic at this point. Now that's changing on a daily basis, and by the time this is published, that may even be old news. But right now, our goal is to test anybody who's symptomatic. If you're requiring emergency level care, the right place to come is to Monmouth Medical Center, and you'll be assessed by our clinical teams, and then you'd be tested. And we do have the ability to do rapid testing, so within an hour, we can have results. If patients or community members are symptomatic but do not need emergency room level care, a number of our urgent care centers in the area are offering testing services, as well as the testing centers that are located throughout the state. I know in the county, the PNCR Center is the one that's most known, and many of our community members are being directed to go there. So there are options out there. It really depends on the severity of your symptoms and where you live. But I would say the best option is if you're feeling that you need emergency room care, please utilize Monmouth Medical Centers or your local emergency room. And if you are if you're not at that level, that's where urgent care centers as well as the state-run testing centers could be very helpful.
Eric, what is the current visitor policy at the hospital, and do you see that getting back to normal anytime soon?
That will be a direct reflection of what's happening as far as the community spread of the virus. So in order to protect our patient population as well as our staff, we've tried to limit the virus from entering into the facility. So we've been screening all visitors. So visitation right now is limited to our labor and delivery unit, our NICU unit, neonatal intensive care unit, as well as for any end of life issues. We're able to facilitate and bring family members in to be with their loved ones at the end of life. Those are the limitations as we currently have them today. We are screening all visitors who come into the facility and assessing them for symptoms and making sure they're appropriately masked before they go to their destination to see their loved one. I expect that visitation will eventually loosen up as community spread decreases. I will share that there's a lot of sides of this pandemic. The human side of just our families not being able to be with their loved ones during their hospitalization is probably one of the most taxing ones for the team here, because we know it's such an important part of the recovery and healing process. So we are committed to getting them open as soon as possible, but only when it's safe for the community to do so.
In terms of non-emergency surgery, when do you anticipate, or is there any timeline for those types of procedures, or even beyond that, just any thought about getting back to just a regular schedule or normal schedule at the hospital?
Yeah, so those plans have been in place for several weeks, and we've been slowly opening up more and more surgical services. The definition provided that we're operate under is medically necessary surgery. So we are taking a very appropriate view of that definition and doing our best to assess what needs to be done today and what care can be delayed. But admittedly, as the weeks go on, it's becoming much more difficult to do so. So we've expanded our surgical services and opened up additional rooms. We have plans to do even further expansion within the next week, and that will occur over a series of weeks and months. I don't anticipate there'll be a flip of a switch where tomorrow we're just offering a full surgical offering. We really do need to be smart with our ability to staff, our ability to care for those patients after their surgical care, as well as the much needed personal protective equipment that is utilized in surgery. So we are working with our clinical leadership and our physicians to strike that delicate balance. But I expect it to expand significantly in the upcoming weeks and months.
I wanted to ask you if you had any final thoughts, but maybe even on a personal level, is there anything you've learned or any lessons that you can share with just this whole experience?
On a personal level, I could share that it's really taught me to connect back to the purpose of why we do the work we do in healthcare. And so to see the clinicians in action, to see our community come together, and to see the amazing patient care that's happening. I mean, you get goosebumps when you think about what's happening here at Monmouth Medical Center every day. I'm just so proud to be part of it. So not that we need daily reminders to why we do the work that we do, and realizing that we're here to serve those who are the most vulnerable. But this has been a powerful reminder of that I don't think I'll ever forget, and will stay with me. And my 25 years in healthcare, starting as a respiratory therapist, this is unlike anything I've ever seen. And again, there's some amazing things that are happening, and there's been some really heartbreaking tragedy that's gone along with that. What I would like to leave as the kind of lasting comment is that, one, I would like to thank the amazing teams here at Monmouth, not only our staff, but also our medical staff, for the work that they're doing every day. They are truly heroes. I want to leave the community with the feeling that they are safe, and here at Monmouth Medical Center, and we have a very high quality organization. Today, we learned that we're going to receive our 11th consecutive Leapfrog A, which is a measure of overall safety and quality within the hospitals. And so, for 11 consecutive marking periods, Monmouth Medical Center has achieved an A rating, which is the highest you can achieve. So we are an amazing organization. We take great care of our community. And even during these very difficult times, we are providing very safe care to everybody that comes to our doors, and they can feel confident if you do need care that we are there for you.
Mr. Carney, on behalf of all the residents of Long Branch, I just want to say thank you again to you, to your staff, to Monmouth Medical Center for being here for all of us in the community. And I'm sure our residents have found this very informative. So again, thank you, sir. I just want to end with, please look at our social media and website for future city spotlights that will air. As always, continue to check our website, longbranch.org, for the most up-to-date information regarding this pandemic. Again, please be well, stay safe, and thanks for joining us today.